Hi, my name is Austin Atwell, and this is my Fixing Long-Term Care final presentation for HCA 228. So what are the problems with long-term care? Affordability. Long-term care is not affordable for many Americans who require it. Elderly Americans are forced to sell off all of their assets or receive family care, while younger Americans rely on government aid and family care to take care of their long-term care needs. Lack of staff. There was already a shortage of nurses and other hospital staff, but COVID-19 has accelerated the retirement of many nurses, causing an even greater staff shortage. And also ethical inconsistencies. So not all people receive equal long-term care. Poor communities and non-white Americans are forced into unacceptable long-term care due to the community that they live in, and also the places that they receive care from are not always the best. So, what's wrong with affordability? Well, 74% of Americans over 65 entering long-term care must liquidate all of their assets just to receive 2 years of moderate care, and 50% of Americans must do the same thing to be able to afford 2 years of extensive care. Only 7% of adults over 50 currently have long-term health care insurance, so they're pretty much banking off of the money that they've saved up and their assets to be able to afford any type of care from here on out. Medicare and Medicaid only cover so much. They don't have any type of long-term care insurance or anything like that. And especially Medicare, it doesn't really do much for them. Because it costs over $90,000 for a shared room and $100,000 for a private room yearly, it's really hard for any American to afford that, especially when they have no source of income. So they'd have to save a lot of money to be able to afford that kind of place. Lack of staff. In 2015, it was predicted that over 1 million nurses from the baby boomer era would retire by 2030. COVID-19 caused many of these nurses to leave to protect their own safety because of health risks, especially when they're a little bit older, as well as many hospitals and medical practices were offering early retirement, or they were furloughing these older nurses out of loss of patients, especially in places like plastic surgery, stuff like that, because that was deemed not needed during COVID. Many of these nurses were furloughed and just decided, well, I'm not going to come back. I'm retiring. Before COVID-19, over 60,000 nurses retired in 2018, which is higher than that 2015 prediction. So we were already over the predicted 1 million nurses by 2030. And COVID-19 is just speeding that up. So nurses, as well as other medical professionals, are very important right now. A plan needs to be made to increase the training of professional nurses so that patients' health is not affected by this. And then finally, ethical inconsistencies. Long-term care equity. Facilities with mostly non-white patients are more likely to not meet federal regulations on level of care. So especially poor, black, any of those communities, when they go in for long-term care, those facilities are not meeting their regulations, which is causing them to have not as good of health outcomes as white Americans or richer Americans. Family caregivers. Many patients who cannot afford facilities receive care from family members. While family members must receive certain training to be paid, they require no training to take care of their family member free. This can lead to abuse, theft, and loss of rights. So while a family member to be paid by the government to take care of their family member, they have to have certain training to be paid and receive that pay, and they're regulated. If, say, the family member just says, hey, I'm going to pay you $15 an hour to take care of me for 20 hours a week, that family member could come and give them inadequate care or only take care of them for, let's say, 10 hours a week and say that they did it for 20 hours a week and steal from that family member, and there's so many worse cases than that. Health outcomes. Patient health outcomes are most important, but they can change dramatically for patients who have the money to afford the best care facility compared to patients who cannot afford long-term care. So patients who can't afford long-term care, they're going into whatever facility they can get to with whatever money they have, and sometimes they don't even have the right to actually look into a couple places because they can only afford that one. So, how do we fix long-term care affordability? Well, first, make long-term care more affordable by passing legislation that encourages affordable pricing from long-term care facilities. I know some of these long-term care facilities are charging over $5,000 a month to live in a 2-bedroom apartment. It's insane. We need to pass some kind of legislation to make sure that those prices can come down, and offer the places that follow that legislation tax incentives and other things, just to make sure that they want to actually help these people. Second, pass legislation that makes long-term care insurance a part of Medicaid. This will allow patients to afford long-term care insurance. A lot of patients don't do it just because they think, oh, I'll be fine. I've got a lot of more years, and then suddenly they're over 65 and they really need it. So if we can somehow pass legislation that makes that a part of Medicaid, makes that affordable for people, and makes them realize how important that is, it would really help those people afford long-term care in the future. And then finally, pass legislation that pays family caregivers more or gives them tax breaks as long as they have the required training. This is going to make sure that family caregivers are, first of all, regulated, and second of all, have the proper training so that they're not burning their family member in the shower, or feeding them something they're not supposed to, giving them wrong medication, all those terrible things that could happen in that kind of setting. Fixing long-term care lack of staff. So, first thing we need to do is bring back retired baby boomer nurses on a part-time basis and allow them to choose their hours. This will bring back those baby boomer nurses that, they can't work as hard as they did in the past, or maybe they can, but they just don't want to. So this allows them to choose their hours, but you give them bonuses for hours with a higher need for staff. So say the daytime hours have more of a need for staff, but you also need some staff at nighttime. Some of those nurses can come back at night if they like the night shift, but those nurses that come back during the day, you give them a bonus. Just say, hey, it's going to be a lot of work, but this way you can get a little more money, save up for that retirement. Give current nurses and healthcare professionals bonuses for overtime and increased amenities to keep them more comfortable and less stressed. This is going to cut down on these nurses and other healthcare professionals leaving because of the lack of staff and that slack that they have to pick up because of it. And then support. Burnout is a huge, huge thing in the medical community. Support healthcare professionals with resources to help them when they are feeling burnt out or stressed. Suicide is also a huge thing, as well as drug addiction in the medical community. So these supports would really help healthcare professionals in staying around, keeping up patient health outcomes, and just overall doing a good job. Fixing ethical inconsistencies. So first, pass legislation that encourages long-term care facilities to meet equity standards. So what that means is you would pass legislation that maybe gives tax incentives or some kind of monetary payout to long-term care facilities that are able to show that they're equitable, show that their patients of color, their patients who don't have as much money, are receiving the same level of care as patients all around the United States. Create a foundation that works to send nurses to communities who are lacking trained medical professionals to increase health outcomes within these communities. So a lot of times these communities just don't have enough nurses, don't have enough healthcare professionals. So if you can create a group that has these nurses on hand and can send them to these different communities and maybe help train, maybe help just fill in until nurses can be found within the community, it'll just help raise those health outcomes for the people in that community, at least until they can find the nurses. And that leads to the final one, pass legislation that works to train new nurses from within a community as long as they work for their community for a certain amount of time. So, they'll get the training, and let's say however long it takes them to train to be that registered nurse, they have to work in their community for that amount of time, or maybe even longer, just to make sure, because they're part of the community, so they'll feel better about helping the people within their community and feel better about sticking around. What did I learn in this class? Well, long-term care is working, but not perfectly. Many people cannot afford long-term care. Patients in poor communities are hit the hardest by long-term care equity, especially people of color. The family caregiver system needs a massive overhaul. At the moment, it's very hard for anyone to take care of their family members as a full-time job. And the medical staff crisis will not end anytime soon. So as a medical administrator, healthcare administrator, it's important to make a plan and start staffing now. Staff for the future, not for your current needs, because this crisis is just going to continue as more nurses and other healthcare professionals start to retire. And these are my resources. and my resources continued. And thank you, and have a great day.